Dr. Meyer, a pulmonologist in Sacramento, California. This week I'd like to talk to you about the cost of healthcare here and abroad. It's been touted that we're spending far too much on healthcare than other countries, and do we get our money's worth? Let me just give you an example here of Mr. Atkins, who was a patient of ours, using a fictitious name. Developed some weakness on one side of his body while he was shopping, and his wife called me on her cell phone, and I suggested that it looks like he may be having a stroke, and he should get him to the emergency room as quickly as possible or call 911. The first few hours after a stroke is really the critical hours if you want to reverse anything. He went to the emergency room, and I got a call a couple hours later from the doctor there, and the doctor had already checked his carotid circulation, because that can be part of the stroke if that's down, and also a CT of the brain, and checked out EKG to make sure there's no clots coming from his heart from an abnormal rhythm. And so we had a lot of information in the first 2 hours and could proceed directly to therapy. This prevents propagation of the stroke and sometimes can prevent the stroke from actually completing itself. Medline reports that there's 19 new drugs for strokes, from clot busters to changing the circulation and dilating the vessels and so on. We have to remember that these things are really not available in 3/4 of the countries of the world. And so to point out the comparison, let me just tell you about friends of ours from London who come to the Jazz Festival here in Sacramento on a yearly basis, and several years ago we noticed one of the group was missing. The drummer boy did not show up, and they said, well, he was hospitalized in London suburb and with a stroke, and he didn't improve over a week, and they thought they should have a CT scan of his head. Well, they don't do those in suburban London, and so he had to be transferred, and the arrangements made and the permission obtained to transfer him to central London, and the CAT scan was done, and the stroke was completed and pretty far along, and there's really nothing you can do at that point in time. So the delay that we see in foreign countries, the waiting list and so on, can be catastrophic. The important lesson here is our present administration is going along. They talk highly about the British system, but the British system has a very low level of quality compared to this country, and we are getting a much higher level of care than any place else in the world. So that's it for this week, and we'll be back with you next time.